the Neijing in the 4th century BC, said that prevention is the ultimate principle of wisdom. To cure a disease after it has manifest is like digging a well when one already feels thirsty, or forging weapons when the war has already begun. For some reason in the field of neurology there is no real emphasis on preventive medicine. You know, we talk about preventive medicine like having a mammogram, but recognize that a mammogram doesn't prevent anything. And having your cholesterol checked and your pap smear done and a PSA from time to time. But for some reason the brain and brain health got left out of the mix. And we, I do a lot of lecturing about aging in the brain, and it seems to me that at these conferences, people seem to be more concerned about the aging of their bodies and their physical appearances than what goes on with reference to their brains. But this next slide, I think, characterizes why the brain, in fact, is so important.
Hello, I'd like to order french fries, a burger, and a milkshake. This is a library.
Let's see, can I get it to work now? All right. So, Linus Pauling called to our attention the fact that the functioning of the brain is dependent upon its composition. It's not just a thing. The brain functions based upon from what it is made. So we have to build a better brain. We have to give the brain what it needs. And this begins in utero. Our children, our babies aren't born out of eggs. They are in intimate relationship with their mother and the mother's nutrition. So people said in my last book, which was Raise a Smarter Child by Kindergarten, well, that takes it from birth to kindergarten. Your next book should be from kindergarten to adolescence. Well, having just put 2 kids through their adolescence, I can tell you that I'm not quite ready to write that book. I'm still getting over it, actually. But in reality, there's a lot that goes on in utero, not just nutritionally, but emotionally as well, that has a fundamental and permanent imprint, to use a Conrad Lorenz term, on the future health and destiny of that child. I want to focus on a very critically important brain fact, and on the quiz that follows the lecture, you need to make sure to get the double bonds in the appropriate position. And DHA is really a key player in brain health. Why? Because DHA plays, and we're going to get a little technical here this morning, believe me, but I'll walk you through it. The main thing that DHA does, this important brain fat, which people talk about as why fish is important in human health, is it has to do with what's called signal transduction. It turns on the gene to make brain's growth hormone. And this BDNF, brain-derived neurotrophic factor, plays a fundamental role in the formation of neurons, in the formation of glial cells that keep the neurons together, in the formation of the synapses where one neuron can talk to the next, and really very important, synaptic pruning. The neurons connect up to each other at a fantastic rate. These are called synapses. During the first 2 months of gestation until 2 years of age, these occur at 1.8 million connections per second. That means in a term infant, there are more connections, synapse to synapse, than there are particles in the known universe. So there's a few connections there. But what is also critically important is that during gestation, these neurons are born at 250,000 per minute, and there are 100 billion neurons in the adult brain. Is having the big brain that humans have fundamentally the reason that we are who we are? And the answer, in my opinion, is no. We are not Neanderthal. We've succeeded where Neanderthal did not succeed, and the Neanderthal brain was 10% larger than ours. So size, I don't say size doesn't matter, but it's not the critical issue. We'll explore later today what is so unique about the human brain that allows us to be who we are and allows us to understand who we are. But more fundamental, I believe, than just the fact that these synapses are born is a process called synaptic pruning. And that is to say a process by which the synapses are thinned, and those synapses that are not necessary wither in favor of those synapses that are being utilized by whatever physical activity that child is engaged in, whatever music he is studying, whatever language she is learning. Those are the synapses that are enhanced. If you don't use them, you lose them. But if you do use these synapses, they are enhanced. Neurotrophic factors enhance those neurons and synapses. And that's why early education in certain types is so important. But it's also why imaginative behavior, imaginative play, is so fundamental for the developing brain to make us human, which is unfortunate when we realize that in education today, only about 10 to 15% of public schools even offer recess anymore in favor of studying for the test. This is an interesting quick scene from the National Institute of Mental Health demonstrating the importance of synaptic pruning, or thinning the cortex of the brain to make it more fuel efficient and make it operate in a faster way. It's getting rid of these synapses, or these connections between these electrical wires that are not required, that are sort of in the way. This is charting the thinning of the cerebral cortex, beginning in the sensory and motor areas, in the parietal regions, but also wonderfully in the frontal poles and in the prefrontal cortex, the more human parts of the human brain. And so what we're doing as we go up to age 20 from age 5 years is we're actually thinning the outer cortex of the brain. We're streamlining it. We're making it lean and mean. It's a critically important fact for the developing infant brain, development of the visual function. We know the fetal brain is growing rapidly. Breast milk contains DHA, another reason why breastfeeding is considered the best choice for feeding infants. When I first began lecturing on this topic in 2002, there was no infant formula in the United States that contained DHA while it was mandated in Europe. Now you can go to your grocery store and find DHA in the infant formulas. Even prenatal vitamins, like the Citracal prenatal vitamin, are now enriched with DHA because of the absolutely profound role that DHA plays in brain health. We've known for a long time that there are neurologic differences between children who are breastfed and children who are not. And interestingly, we're now the information is really focused on DHA. When you look at neurologic dysfunction, twice as high in kids who are not fully breastfed for at least just 21 days of life. That's just 3 weeks. But this study from Australia shows us that, in fact, if you look at IQ and also the scholastic ability tests at 8 and 12 years, higher levels of attainment in school, leaving examinations as well, all of these things are increased comparing groups of children who are breastfed versus children who are not. Their emphasis then is on the fundamental importance of DHA, which only until recently was not found in infant formula. But we're going to explore breastfeeding and mother-child interaction a lot more deeply today, and recognize that there are some other much more powerful forces at work when a mother breastfeeds a child that are not specifically chemicals found in the breast milk as opposed to what might come in a bottle. But their conclusion is DHA is an essential nutrient for the optimal neural maturation of term infants. They said term infants because that's what they studied. I would obviously include premature infants and really any infant. So the question is then, what happens? The child is born, and then if he or she is breastfed, he or she is going to be obtaining the DHA from mother's breast milk. And interestingly enough, as you would expect, the infant gets the DHA from mother's physiology. You know, it's what mother does, right? Mothers give of themselves, and in this case, they're giving of their DHA. And interestingly enough, low levels of DHA are correlated very, very strongly with depression, especially postpartum depression. And there are now several interventional trials that have demonstrated a significant reduction in postpartum depression in women who have increased their DHA. Well, as a matter of fact, when a woman adds DHA to her regimen, there's a dramatic increase in the amount of DHA in breast milk. So going just a 2-week period, supplementing with DHA versus not, you see right off the bat, this is when the child begins to breastfeed. This is what happens to DHA normally. It falls. But if you supplement, if a woman just takes 200 milligrams per day, which I think is kind of a low dosage, then her DHA content increases. So it's very important, in my opinion, that women understand they need DHA during the time of nursing. And as a matter of fact, you'll learn today, we all need DHA through our entire lifetimes for some very important reasons. But the conundrum is that where is, your typical source of DHA? Eating fish, right? That's what we're told. That's why fish is brain food, because it's high in DHA. But are women not told that during pregnancy and breastfeeding they should limit the amount of fish that they consume because of mercury and PCBs? That is a very good recommendation. The good news is, however, that there are some vegetarian-derived DHAs available on the market, and at any health food store that you could go to, you can just walk in and say, I need a DHA supplement not derived from fish. And I like to ask my audiences, usually doctors, we talk about, well, which supplement is highest in DHA? Anchovy oil, krill oil, salmon oil? What is, in nature, what is the highest source of DHA in nature, in Mother Nature? Salmon. The richest source of DHA on the planet is human breast milk. So here we are. This is the child that we'd love to have, and this is the child that we often see day to day in our offices. And there's a certain approach that modern society takes to these kids, and we'll get to that in just a moment. But again, let's talk about prevention. What can we do to prevent ADHD? These kids are wired. I see them in my office every single day, and it's very, very challenging. Well, right off the bat, I've shown you that risk of neurologic issues is increased in kids who are not breastfed. And this is the number of ADHD percentage who are breastfed versus those who are breastfed. And the time that, even if they were breastfed versus the time of being breastfed for the control group that does not have ADHD. But let's look at DHA and just compare the DHA levels in boys who have ADHD versus those who do not. And this is very, very dramatic. You can look at the amount of DHA within the red blood cell, and you can see a dramatic change, a dramatic increased amount of DHA in the kids who are not requiring drugs and not on Ritalin. Supplementation of these oils to ameliorate these observed abnormalities in the fatty acid profiles might be something reasonable to do. Might even consider doing an interventional study. And in matter of fact, this was a publication demonstrating that giving DHA to kids, 60% of them presented asymptomatic on the the test of variable attention. In other words, this is a marker of hyperactivity and being able to stay on task. Just giving them DHA and not intervening with vitamin R was very, very helpful in settling these kids down. Because they're super aggressive and they're just on fire. Their brains are literally on fire. DHA is probably one of nature's most important anti-inflammatories. DHA acts as a COX-2 inhibitor like Celebrex and Vioxx and NSAIDs, ibuprofen. This is a child we would love to have. Look at that face. That's a non-allergic face, a non-inflamed face. No allergic shiners under his eyes. I think it's a his. But you might ask then, are we driving our kids too quickly? Are we demanding too much of them? And is that the cause of the widespread issues? And maybe we're driving our kids too quickly, but I submit that these kids can handle a lot. Keep in mind then that DHA might be a very important missing piece of the puzzle as to why 25% of kids in school now are medicated in one form or another, either on medications for their ADHD or even on medications for depression and even bipolar, which is becoming rampant. But here's a billboard, road sign that isn't real, of course. I put it up there, and this is what we think happens, that kids go to the nurse supervises them taking their drugs, but in reality, we know that other things happen with their drugs. Well, this is a kid with ADHD, happens to be me. This is my report card from the first grade that I've saved all these years. Actually, my parents saved it, and they just gave it to me, and I was quite surprised. I remember the days. And on this report card, a check indicates that the pupil needs improvement. And I got lots of checks in those days. And in fact, they had to add cafeteria to my experience because it wasn't even on the report card. I think obviously I did my best work in the cafeteria. David is capable of better work if he would settle down to more controlled behavior. I was all over the place. And frankly, I think that the issue was I was a bit bored in the first grade and through 12th grade. And Probably the most effective drug I could recommend for your child is Ritalin. Dad said if a strange man offered me drugs, I should just say no. This is what happens on college campuses to Ritalin. And this is what happens in high school to Ritalin. And this is what happens in middle school and elementary school with kids